This young lady has had massive reconstructive surgery on her jaw and face and has come for help.
Gretchen, I'd like to know a little bit why you came to see me.
As soon as I picked up my trumpet after jaw surgery, I knew that it was going to be a challenge and that I really had my work cut out for me. And this is not something that the average person has done, and I really had special circumstances having had the surgery that I had. And so I knew that I needed to find someone that had the expertise and that had the experience to guide someone like me through this process and to help me get back to it. So as soon as we found out about you, I definitely knew that that was something that I wanted to take advantage of. Because it's not something that my band director or that my friends or anyone like that could really help me with. And so coming to see you as soon as I came, like I said before, I couldn't play a note and I had extremely difficult problems being able to play my trumpet. But you were able to guide me through it and to coach me through all the steps that it takes to be able to start back again and really work through the challenges that I had before me.
This young lady came to me for help at about 3 months post-surgery. You are seeing her now at about 6 months post-surgery, and I'm wondering what kind of advice she would give to others who have similar problems with reconstructive surgery or mouth problems when attempting to play the trumpet or other musical instruments.
I would say absolutely. If they feel like they need help, then that's the right thing to do and that they should seek help. And that there are people like you and people like their band directors that are out there and that are willing to help them. And I think it's especially important for people that have been in a car accident or are having surgery similar to what I had, that it's not impossible and that if you have the determination to get back to it and that you have the drive, that there are so many possibilities and there's so many people out there that are willing to help you and so many resources, just like the mouthpieces that you've been able to work with me on. There are just hundreds and hundreds of options on how to best correct the things that need some work. So I would definitely say that if there are people struggling or people that think that it's not possible, I guess I'm an example of how you can get right back into it. And it takes time, you have to be patient, and that's something that I had to work on. I'm not a very patient person, and I just wanted to get right back into it and play the first day. And that didn't happen, but it happened a lot faster than I expected after I came to see you and after I picked up my trumpet and played the note for the first time.
The important thing, I think, Gretchen, is getting the right kind of guidance.
Exactly.
Because like we've talked about, when you have a problem, it's so easy to slip into the easiest way to play, not necessarily the right way to play.
Yes.
And so then, although you can play and play sometimes relatively well, you're stuck at that level.
Exactly, and I think based on how I played before and given the condition of my mouth before, if I had tried to play like that after surgery, I would have been playing down to the ground with a bad angle, with bad air support, with probably a bad mouthpiece. And the whole combination of it would have really taught me bad habits going back into it. And so I think it's just crucial to get the right kind of help. Absolutely.
Of course, you're saying the key, and that's the right combination.
Right.
It's not one thing.
Exactly.
Like we say, you can't just go out and buy the right mouthpiece.
Right.
Or you can't just ask a teacher to teach me again.
Right. Or it's not going to buy a new horn. It's
exactly.
the whole package.
That's exactly. Well, I do thank you so much, and I want one more question, if I may. How are you playing now in comparison to what you played before you had the surgery?
I'm very happy with the way that I've gotten back, and I think I still have room for improvement. Certainly my range is the one thing that I'm trying to work on right now. I'm extremely happy with my sound. That was the one thing that band directors over and over praised me on and said that I had a great sound, and you've been able to help me find that sound again and be able to create, the same sort of sound that I had before.
Let's give a big gong sound.
But I certainly would like to work in my range and we're getting there in terms of the range, and I'm sure I'll keep getting better and better as time goes on and as everything heals. And it will change, like you said, and I'm prepared for that, and I know you'll help me get through all the changes that I'll have in the next couple months.
We'll do it.
Okay, thank
Thanks.
you.